Hi everyone, this is Daniel Buchan. Today we're going to be talking about the head and neck, ear, nose, and throat physical exams. The eye exam will be discussed in a separate video. As always, I want to make sure to thank Adriana Della Porta, Maria Velasquez, and the Ana Clario Learning and Assessment Center, without whom these videos would not be possible. So today we're going to go over the video in three parts. Part one, we're going to do a detailed demonstration of all the individual parts of the standard exam. In part two, we're going to show you putting all of those parts of the standard exam together. And then in part three, we're going to break down a few special tests. So with all that out of the way, let's get started. The exam begins by conducting an initial, broad inspection of the face, head, neck, and scalp. Specifically, we are assessing for any facial asymmetry, involuntary facial movements, and any obvious rashes, lesions, swellings, injuries, or scars of the face, head, neck, or scalp. Further, closer inspection of the ears, nose, and throat will be conducted later on as specific parts of those exams. In this next series of video clips, we're going to be demonstrating how to conduct palpation of the head and neck lymph nodes. Good lymph node palpation requires two things: proper technique and being intentional about where you are palpating. As will be shown here, you should palpate by using 2 or 3 fingers, moving your fingers in tight circles. There are 10 sets of lymph nodes which we will palpate as part of the standard head and neck lymph node exam. 9 of these are superficial nodes and may be palpated via the standard palpation technique we just discussed. The deep cervical lymph nodes, located deep to the sternocleidomastoid muscle in the neck, are the exception and will require a unique maneuver to be palpated, which will be demonstrated momentarily. Finally, know that it is common for lymph nodes to not be palpable on physical exam in a normal, healthy individual. If you don't feel anything while you're practicing, that's okay. The next 3 video clips you'll see show superficial lymph node palpation from the posterior, lateral, and anterior perspectives. The examiner begins by palpating the occipital nodes located immediately inferior to the occiput, then moves to the postauricular nodes located behind the ears overlying the mastoid process of the temporal bone. After this, you can observe as the examiner palpates the preauricular nodes anterior to the tragus, then to the 3 sets of lymph nodes along the jawline, which are the tonsillar nodes, submandibular nodes, and the submental nodes, before finally ending with the anterior and posterior cervical nodes and supraclavicular nodes. This lateral view is good for visualizing where to palpate the preauricular nodes located anterior to the tragus, followed by the tonsillar nodes located immediately posterior to the angle of the mandible, followed by the submandibular nodes, which tend to hug along the inner wall of the mandible, so you may need to hook your fingers a little bit, and then the submental nodes, which are located midline on the underside of the chin, approximately 2 to 3 centimeters back from the tip of the chin. This anterior perspective is good for observing where to palpate the anterior cervical nodes, located along the anterior border of the sternocleidomastoid, the posterior cervical nodes, located along the anterior border of the trapezius muscle, and the supraclavicular nodes, located superior to the clavicle in the midclavicular line. The left supraclavicular node specifically is known as Virchow's node, and is a common site of metastasis for breast, lung, and GI cancers due to its close proximity to the thoracic duct. The last part of the head and neck lymph node exam is palpation of the deep cervical nodes. These nodes are located along the inner surface of the sternocleidomastoid muscle, so we need to lift up the muscle in order to palpate the lymph nodes on its underside. To facilitate this, we ask the patient to look down and towards the knee ipsilateral to the side we are palpating. This slackens the sternocleidomastoid muscle, making it easier to lift. To palpate the deep cervical nodes, begin by placing your fingers along the anterior edge of the SCM, with your thumb along the posterior edge of the SCM. With the SCM muscle relaxed, gently pull the muscle away from the body, hook your fingertips around the anterior edge of the muscle, and palpate for the deep cervical nodes on the underside. As you palpate the deep cervical nodes with your fingers, it is important to provide counterpressure with your thumb at the same time, as this prevents the deep cervical nodes from being pushed out of the way. In the next 3 clips, you will see a demonstration of the technique I have just described. All of the clips are showing the same technique, simply from different angles. In this next series of clips, we will be going over the ear exam. The ear exam begins with a visual inspection of the external anatomy. Intentionally observe the pinna, tragus, earlobe, and opening of the external auditory canal of both ears, assessing for lesions, rashes, and deformities. After inspection, manipulate the pinna and earlobe and palpate the tragus and mastoid process, asking the patient if they experience any pain or discomfort. Begin the otoscopic exam of the ear by ensuring the otoscope is set to the maximum brightness and attaching a fresh speculum. You will hold the otoscope in one hand, as shown here. The next 6 clips all demonstrate how to perform the otoscopic exam of the ear. They are all demonstrating the same thing, but are shown from different angles. As you watch these clips, observe the following technique. Begin by grasping the pinna and retracting it up and back. Doing this straightens the ear canal, making the tympanic membrane much easier to visualize. Poor retraction of the pinna is one of the most common reasons learners have trouble seeing the tympanic membrane. As you bring the otoscope up to the patient's ear, you should use your pinky on the patient's face in order to stabilize your hand. With your hand stabilized, begin to move the speculum into the ear canal, making sure to maintain traction on the pinna the entire time. After the tip of the speculum is inserted, look through the otoscope to visualize the ear canal and tympanic membrane. When visualizing the tympanic membrane, remember to note its color and contour. The healthy TM is often described as being pinkish gray or translucent in color and in neutral position. After completing the otoscopic exam of both ears, attach a fresh speculum and prepare to perform the otoscopic exam of the nose. Perform the otoscopic exam of the nose by asking the patient to tilt their head back, inserting the speculum approximately 1 to 2 centimeters into the nair, and looking through the otoscope to visualize the nasal septum and turbinates, noting their appearance. In these next 2 clips, we will demonstrate visual inspection of the oral cavity and its associated structures. You will begin by briefly inspecting the external anatomy of the lips and the corners of the mouth before asking the patient to open their mouth to observe the oral cavity. When inspecting the structures of the oral cavity, I recommend using a systematic approach that goes front to back and bottom to top. After the patient opens their mouth, instruct them to lift their tongue and inspect the floor of the oral cavity. Next, inspect the tongue, then the insides of the cheeks, known as the buccal mucosae, then the hard palate, then the soft palate. Next, ask the patient to stick out their tongue and say ah, in order to visualize the structures of the posterior oropharynx. Specifically, we are inspecting the tonsils, uvula, and pharyngeal mucosa. As you watch these next 2 clips, do your best to identify the anatomical structures we have just discussed. The last part of the standard head and neck physical exam is thyroid palpation. Begin by standing behind the patient and palpating the thyroid cartilage, also known as the Adam's apple. After identifying the thyroid cartilage, palpate down the midline to the cricoid cartilage, which will be the next prominently palpable structure. Once here, place your fingers on either side of midline, instruct the patient to dip their chin slightly, and apply light pressure with your fingers. Then ask the patient to swallow. Swallowing causes the thyroid gland to move up, then back down, and you will palpate it as it slides beneath your fingertips. In part 2 of the video, we're going to show you what it looks like when you put together everything we just demonstrated in part 1. The examiner begins by introducing herself to the patient before moving on to her broad visual inspection. Again, she's looking for any facial asymmetries, involuntary movements, rashes, lesions, or the like. She also makes sure to check the scalp. After finishing her visual inspection, she moves on to lymph node palpation, palpating the occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular superficial lymph nodes. After finishing with the superficial lymph nodes, she palpates the deep cervical lymph nodes bilaterally, asking the patient to tilt their head down and look to their knee on the ipsilateral side, lifting the SCM muscle and palpating the deep cervical nodes located on its inner belly, making sure to use her thumb to provide counter pressure. After completing her lymph node exam, she begins her otoscopic exam. She attaches a fresh speculum and moves to start performing her ear exam. You can't see it here, but she does a visual inspection, assessing the pinna, tragus, and other ear structures for tenderness as well, which you'll see her do on the other side. As she inserts her speculum, she stabilizes with her pinky, and then looks through, assessing the tympanic membrane. Again, you can see her check for tenderness. She retracts the pinna up and back, stabilizes with her pinky, and looks through. Having finished her otoscopic exam of the ear, she discards her speculum, attaches a fresh speculum, and will move to perform the otoscopic exam of the nose. She has the patient tilt their head back, rest the speculum at the base of the nair, inserts 1 to 2 centimeters, and then looks through the otoscope. Here she's looking at the septum and the turbinates. Done with that, she discards her speculum, and then performs her observation of the structures of the oropharynx. Remember, we like to use a systematic approach, whatever that be for you. I like to go front to back, bottom to top. Having finished her observation of the oropharyngeal structures, she finishes with her thyroid palpation, finding the thyroid cartilage, moving down to the cricoid cartilage, having the patient tilt their head down and swallow. And that's the standard exam, all done in just under 3 minutes. As indicated here, the temporomandibular joints may be palpated by placing 2 fingers anterior to the tragus and asking the patient to open and close their jaw. As you palpate the TMJs, feel for crepitus, popping, and ask if the patient experiences any discomfort. To check for temporal artery tenderness, simply palpate the temples. This test is most frequently done if you suspect giant cell arteritis. To check the frontal sinuses, apply upward pressure from beneath the eyebrows. Here we show it again from a lateral view. Notice, as the examiner performs this, they stabilize their hands on the sides of the patient's head. To assess the maxillary sinuses, press upwards from under the zygomatic bones, also known as the cheekbones. Again, we show this from multiple angles. The final set of special tests for the head and neck physical exam that we're going to discuss in this video are the Weber and Rene tests for unilateral hearing loss. While the technique underlying the performance of these tests is quite simple, the interpretation can be quite confusing for many students. So before beginning, we're going to take a brief pause and talk about it. The first thing to understand is that you always perform the Weber test first. If the Weber is abnormal, then you perform the Rene. If you have a normal Weber, then you're done. You do not perform the Rene if the Weber test is normal. In a normal Weber test, a patient will report hearing the sound equally in both ears. In an abnormal Weber test, the patient will say the sound is louder on one side compared to the other. If a patient has a lateralizing Weber test, then we next perform the Rene on the ear where the sound was louder. In this next series of clips, we're going to demonstrate how to perform the Weber test. Begin by striking the tuning fork firmly against your palm, setting it ringing. As you set your tuning fork ringing, place it at the crown of your patient's head, directly in the center. As you place the tuning fork, ensure your fingers only touch the stem, never the body. If your patient has thick hair, you can place it at the center of the top of the forehead instead. Here we indicate the mastoid process behind the ear. This is where you will place the stem of the tuning fork if you need to perform the Rene. Perform the Rene by setting the tuning fork vibrating and placing the stem on the mastoid process. Ask the patient to tell you when they can no longer hear the sound. When the patient indicates this, take the tuning fork and place it next to their ear, asking if they can hear the sound again. This concludes our demonstration of the head and neck, ear, nose, and throat physical exams. We covered a lot, including lymph node palpation, otoscopic exams, thyroid palpation, and a number of special tests. Remember, practice makes perfect. When you've mastered this exam, you should be able to perform it in under 3 minutes with ease. Developing mastery with the HENT exam is well worth your time, as it is indicated for many of the most common reasons someone might go see the doctor, including strep throat, ear infections, and sinus infections, as well as things like headache, thyroid disease, hearing loss, and even cancer. Thank you for your time, and we'll see you in the next video.